With the epidemic of opioid addiction getting more attention in the press, I wanted to give you a simple, systematic approach that will help you apply some of the powerful tools you have at your disposal. I've included a more detailed discussion for the really tough cases. By now everyone is on board that chronic inflammation underpins almost every major disease. Dr. Alex Vasquez reframes the term chronic inflammation and calls it sustained inflammation. This is an important concept because patients have to understand that the lifestyle and dietary choices they make sustain their inflammation and pain. Dr. Vasquez points out 4 major areas that contribute or sustain inflammation: poor diet or fuel choices, xenobiotic compounds, infections and subsequent microbial toxins, and a leaky gut. Let's look at these briefly and a solution to overcome them. Poor diet. The standard American diet creates oxidative stress because it's low in antioxidants, and at the same time creates oxidation and impairs the ability of the body to fight infectious agents. Remember the study that showed a hash brown, egg, and sausage breakfast sandwich caused a 150% increase in the pro-inflammatory NF-kappa B for 2 hours? Many people will consume foods that will sustain inflammation all day long. Let's look at the second area, xenobiotic compounds. One of the easiest ways to help patients jumpstart their diet and eliminate xenobiotic compounds is with the NutriClear Plus Cleanse program. NutriClear Plus comes with 30 pouches of a gut-healing, restoring powder that mixes well and tastes good, and 30 packets of supplements to promote digestive liver health. Take 1 pouch and 1 packet of nutrients twice a day, either as meal replacements or in between meals. You can see a link for the exact ingredients. But the best part of the program is the easy-to-follow anti-inflammatory diet. With chronic pain, changing one's diet is essential. This program takes all the guesswork out of the equation by giving foods to increase and avoid, as well as sample menus. The third area that sustains inflammation is one that we've been talking about for years: infection and subsequent microbial toxins. Microbial toxins impair mitochondrial function, and if a patient has mitochondrial impairment, they don't have the cellular energy for tissue and cellular repair. So if you suspect an infection or gut issue, you have to start there first. On the other hand, many people around the world carry infections and parasites in their gut and don't have chronic pain. By restoring the integrity of the gut, increasing the biodiversity of the microbiome, and reestablishing healthy bioflow, the immune system of the GI tract can often restore order. So unless there are obvious infections or SIBO, small intestinal bacterial overgrowth, let's support the body's detox functions and repair the gut. At the same time, use nutrients that globally support the health of the cell and the brain first. If that doesn't make the difference, we can hunt for hidden infections. The 15-day NutriClear Plus program starts this progress. To address the fourth area, leaky gut, once the 15-day cleanse program is completed, continue with the anti-inflammatory diet and add the following supplements to support gut health and reduction of pain and inflammation. Curcumin RX. Research suggests curcumin may be helpful in treating a variety of inflammatory conditions such as inflammatory bowel diseases, joint pain, rheumatoid arthritis, obesity, metabolic syndrome, heart disease, atherosclerosis, degenerative disorders, Alzheimer's, and others. Curcumin appears to reduce NF-kappa B, a genetic pain inflammation amplifier, as well as reduces amyloid plaque. Another benefit is that it upregulates the body's ability to make its own antioxidants like superoxide dismutase and glutathione. As a bonus, curcumin supports or maintains intestinal barrier function. Consider 1 BID. Caprest. 7 of the 8 phytonutrients are specifically designed to reduce NF-kappa B. It's the synergy of the nutrients that has made Caprest an all-star in the biotics line to support the genetic downregulation of NF-kappa B. Consider 3 BID. IPS. Intestinal permeability support. IPS is designed to stimulate growth and repair of the intestinal mucosa and also aid in gut detoxification. Dr. Gary Lesniewski developed IPS to calm an overactive gut and immune system. Use 2 BID. Biodof 7 Plus. To restore microbiome diversity, Biodof 7 Plus contains prebiotics to ensure food and housing for healthy bacteria and 7 different probiotic strains yielding 20 billion organisms per capsule. Use 2 at bed. Biodemulsion Forte. supplies vitamin D3 and has multiple mechanisms to reduce inflammation and can reduce C-reactive protein by 23%. Vitamin D can help alkalize the system, which reduces pain and increases endorphins. It's also vital to maintain tight junctions in the gut. Each drop of Biodemulsion Forte contains 2,000 international units of vitamin D3. Use 5 drops a day. Biomega 1000. Omega-3 fatty acids have been shown to be essential for all cell membranes, especially gut membranes, pain modulation, and brain health. Consider 1-TID. BioLA contains a proprietary combination of 3 unique herbal extracts, white willow, devil's claw, and boswellia, which collectively support comfort levels and promote enhanced activities of daily living. Use 2-TID. Dr. Vasquez has written extensively on the mechanisms to reduce pain. See the links to his work. Our goal as clinicians is to develop a simple program to help patients experience what it's like to live without inflammatory triggers, while providing botanical extracts and essential fatty acids and key nutrients that inhibit or turn off the genetic expression of pain and inflammation. Thanks for watching, and I'll see you next Tuesday.